Hi, I'm Jim Spellman. I'm a CGTN correspondent based in Washington, D.C., and I'm just outside Washington, D.C. right now at the U.S. National Institutes of Health, and I'm going to run down everything that we know at this point about the monkeypox crisis here in the United States. Just to set the scene a little bit here, the U.S. National Institutes of Health is the premier public health organization for the United States federal government. This is where Dr. Anthony Fauci works, and thousands of other scientists and researchers come. It's about 1.5 square kilometers big, and this is really the hub and coordinating center for U.S. public health response. Other agencies, of course, include the U.S. Centers for Disease Control and the Food and Drug Administration. They're all, those two of them are based here in Washington, one in Atlanta, Georgia. We'll be talking about these agencies and how they coordinate together. So let's start with where we are right now with the monkeypox crisis. As of yesterday, the United States has about 10,700 confirmed cases of monkeypox since about mid-May, when this crisis began here in the United States. Now, we expect there actually have been many more cases than that because testing has been limited in the United States, and there's really been an increased effort to increase awareness so that people know when and how to get tested. But we think there have actually been many more cases than that. Now, the good news is that so far in the United States there have been no deaths, and hospitalizations, it's difficult to track exactly. Hospitalizations also relatively rare. A British study showed about 10 to 15% of people are hospitalized. If you look at that, that would perhaps suggest that a few hundred people at any given time in the United States may be hospitalized. Generally, these are short visits to the hospital to deal with pain and to manage some infections at some of the sores, the lesions that we'll be discussing soon. Globally, about 31,000 cases associated with this current outbreak. So let's start with the basics of what monkeypox is. It's somewhat related to smallpox, and that's important because some of the treatments and vaccines are related to research that's been done for smallpox. Now, monkeypox has been endemic in areas of Africa, but it's been rare for it to spread beyond Africa. This current outbreak, believed to have begun in Europe, and now the epicenter of this is clearly here in the United States, where cases have been going up rapidly. Just yesterday, the U.S. recorded over 1,000 new cases. Now, part of that is expected because testing is becoming more widespread, but nonetheless, this is a growing concern here in the United States. And while this is associated, on the molecular level, medically with smallpox, it's a much milder disease in almost all cases. It spreads through close skin-to-skin contact, and that's problematic for a number of reasons that we're going to get into. It has about a 3 to 17, perhaps 21-day incubation period. So that's the amount of time it takes from exposure to begin having symptoms. Averaging so far is about a week. That's problematic as well because, as we saw with COVID, that time is when people can be contagious, potentially spreading as the virus builds up inside their body, but them not quite knowing that they have it yet. The first symptoms that people typically experience are fever, muscle ache, fatigue, headache, flu-like symptoms, which can often be confused with the flu, or of course more recently can be confused with COVID-19. But what's distinctive is those symptoms are often followed by a very distinctive rash that can begin as one or more bumps that can turn into sores. And a lot of the hospitalizations we're seeing is sometimes those sores can become infected. Now, typically, a course of monkeypox will run its course in about 2 weeks, sometimes closer to a month, and usually it does not require any medical intervention, although it's very scary for people who may get it and may not understand what's going on. This current outbreak has been a little bit different than ongoing cases of monkeypox that we've seen in Africa, in that there are fewer cases of fever associated with this current outbreak. Unclear why. Perhaps this is a different strain. The researchers have not quite been able to figure that out at this point. So up to now, here in the United States and in Europe, almost all of the cases of monkeypox in this current outbreak are in men who have sex with other men. So even though this is not a sexually transmitted disease per se, it is often spread by close skin-to-skin contact. And it's been making its way through the LGBTQ community here in the United States. And that's created a number of issues. So as the Biden administration tries to respond to this, they have to speak directly to that community, but they also can't stigmatize that community. And the gay community here in the United States was so traumatized and scarred, and many people died in the HIV/AIDS epidemic that began in the 1980s. And really, it was years before the federal government took that seriously, dismissing it since it was happening in the gay community. Dr. Anthony Fauci, who we've all seen guide the U.S. response throughout COVID-19, he really became a prominent public health official dealing with HIV/AIDS in the 80s, and he's been particularly sensitive to how to go forward with this, learning from what the public health community took from HIV/AIDS in the 80s. And what that means is speaking directly to the gay community, but not stigmatizing them, speaking to them in a way that's respectful, and importantly, the Biden administration says, finding trusted people in that community to reach out directly to them, and also to use social media, trusted people in that community. What we're hearing from some gay men who have either contracted monkeypox recently or are fearful of it is that they are trying to change their habits. So that may mean having fewer sexual partners, canceling or skipping big events where there could be lots of dancing together and bodies connecting and things like that. So that is the community that's most affected. Also the community that has become mobilized to try to work within their own community to try to get ahead of this and stop this from getting worse. So the Biden administration criticized for not responding enough to this, especially in the early days of this. Last week, they really ramped up their approach. First, they named a federal coordinator to oversee the federal response, to coordinate places like the U.S. National Institutes of Health, the Centers for Disease Control, and all of the state public health agencies around the United States. His name is Robert Fenton, and he comes from the Federal Emergency Management Agency. That's the agency that you often see responding to things like a hurricanes or flooding. He comes from that community. So that's a signal that the White House is taking this much seriously. They've also started holding briefings on this a couple of times a week, just like we saw with COVID-19. Also last week, the administration declared this officially a public health emergency. That frees up money, it frees up staff, and then it's able to cut some of the bureaucratic red tape to better respond to this. You are seeing the Biden administration leverage all that agencies like the NIH have learned from handling the COVID-19 case. So they're focused on three main things: testing, vaccinations, and treatments. So we're going to begin here with vaccines. So far, there's only one vaccine for this. It's made by a company in Denmark. The vaccine is known as Janios. And the U.S. has secured what they think are enough doses. The problem is the timeline and distributing them. So far, the U.S. has distributed about 600,000 doses of vaccine to all the states around the country. Remember, the U.S. does not really have a national healthcare system that can oversee this. So it means coordinating with state and even county level public health officials. So 600,000 doses out in the community, but the White House estimates that there are about 1.6 million high-risk people who should be vaccinated immediately. So what we've seen is clinics that only open perhaps one day a week. The public health clinic here in Washington, D.C. is only open one day a week for walk-up vaccinations and only for a few hours in the afternoon. And many clinics in places like San Francisco, New York, Washington, D.C., Los Angeles, places with large gay communities, are seeing that they simply don't have enough doses to vaccinate everyone that needs it. And it would be October before they are able to get enough for that whole 1.6 million doses. So the National Institutes of Health, along with the Food and Drug Administration, have been working on a way to stretch what they have by what they call dose sharing. So this is a really interesting and somewhat contentious. So a vial of the Janios vaccine that normally would contain one dose can be administered, it's typically administered under the skin like a normal injection. It can also be administered between the layers of skin And by doing it that way, there's more absorption. They believe that they can get 5 doses out of a single dose vial of this. It's controversial. The Food and Drug Administration, though, this week gave the go-ahead to start doing that. So that would potentially mean that there could be enough doses to handle all 1.6 million high-risk people. Also, this week, the Food and Drug Administration has approved on an emergency use basis the vaccine for children. And the reason that's important is because there can be outbreaks if somebody with monkeypox has a child in their household, or perhaps is a caretaker at a school or a daycare center or something like that. We've seen spreads like that historically in the past. So high-risk children who could be in that type of group could receive the vaccine now as well. The CEO of the company that makes the Janios vaccine, it's a company called Bavarian Nordic in Denmark, though, is expressing concern about this. He says there's simply not enough data from studies to understand what the implications could be of doing this, and he's fearful that it simply is not going to be safe. That said, the U.S. is going ahead with this now. It's going to be a week, 2 weeks or so until we see how this impacts the number of people that are vaccinated, and longer than that to see if it's effective. Many of the people that work in these public health clinics will have to be trained on how to give this type of injection. It's more difficult. So this is definitely a bit of a work in progress. Testing. So initially there simply weren't tests around. Clinicians didn't know what to look for. Now that is increasing. That's one of the reasons you're seeing more confirmations of cases here. For a while, people were showing up in hospitals at their doctor's offices with these sores, and they were being misdiagnosed, and there wasn't an awareness about testing. Now it seems that the testing situation has gone better. They hope that that will help stop the spread by being able to confirm that somebody has this case, informing them of what it is. That person can then essentially quarantine for a few weeks like we saw with COVID, and hopefully that will stop the spread. Lastly, treatments. So there are antivirals developed for smallpox that are being used for monkeypox. One is called TPOX, and it is approved in Europe, not approved in the United States, but a rapid study is going on, and under emergency use that is being made available to some patients here. Keep in mind, most patients do not need this, and it will clear up on its own, though it's uncomfortable and of course can be spread. It's not something needed, but certainly we're hearing advocates in the LGBTQ community saying there needs to be more TPOX out there, less red tape to get it, so that this can be something that people can get immediately to get relief, as well as to help stop the spread. So we should keep a few things in mind, big picture. This is not COVID. As I said, nobody in the United States has died, and it's unlikely that monkeypox is going to overwhelm the healthcare system like we saw. Just over here is a regular hospital, it's called Suburban Hospital, and in the height of COVID-19, there were trailers set up outside to treat people. You almost could not go for any other reason because they were so overwhelmed with COVID patients. We do not expect to see anything like that associated with monkeypox. So that's the good news in this situation. But they're taking it very seriously at the federal level and at the state level. And I'm going to sign off here in a minute with a quick recap. 10,700 cases in the U.S. since May, but so far, no deaths. The goal of the Biden administration, the goal here at the National Institutes of Health, and the goal of everybody in the public health community is to try to make it so that nobody dies of this illness. So I'm Jim Spellman, signing off from the U.S. National Institutes of Health, just outside Washington, D.C.